Welcome to the WebMD Health Discovered podcast. I'm Dr. Neha Pathak, WebMD's Chief Physician Editor for Health and Lifestyle Medicine. When you hear the term medical marijuana or medical cannabis, what comes to mind? Do you think about smoking pot, eating gummies for sleep, or the legalities surrounding it? For a lot of us, it's a confusing mix of a variety of terms: CBD, THC, medical marijuana, hemp, cannabis, and it's hard to make sense of it all. It's hard for us to know when is it medically appropriate. It's also hard for us sometimes to figure out if a product that we're seeing on the shelf is FDA approved or FDA sanctioned for the use that it's being marketed for. As a health platform and informational guide, we're going to take a step-by-step approach to exploring cannabis for its medicinal use and potential health risks. We'll set the record straight on common misconceptions and explore the evidence behind the medical uses of cannabis. But first, let me introduce my guest on this topic, Dr. Jackie Bainbridge. Dr. Bainbridge is a professor and vice chair of research in the Department of Clinical Pharmacy at Skaggs School of Pharmacy and Pharmaceutical Sciences and the Department of Neurology at the University of Colorado Anschutz Medical Campus in Aurora, Colorado. Welcome to the WebMD Health Discovered podcast, Dr. Bainbridge.
Thank you so much. It's really a pleasure to be here.
I am really looking forward to our conversation today. But before we start exploring the topic, I'd love to ask about your own personal health discovery. What got you interested in the study of medical cannabis in the first place?
Yeah, that's a very interesting question, and I get asked that question all the time. So it's certainly not because I was dabbling in the science or dabbling in cannabis. But a great number of our patients in the neurology clinics were using cannabis to treat some neurologic condition. And really, our practitioners, no one really even knew, was that appropriate, not appropriate? Was it safe? What about drug interactions? And where are you getting the product? And is it a consistent product? So safety, efficacy really were at the heart and soul of really trying to answer this question. So we really needed to do a deeper dive, and that really led me in the research pathway with cannabis and more specifically several different cannabinoids.
First, I'd love to start by just defining some common terms we hear when we think about this topic. So from medical marijuana, medical cannabis, hemp, CBD, THC, there's a lot of terms. So let's start first with, if you could just help us understand, what do we mean when we say medical marijuana, medical cannabis?
Thanks for starting out with that, because I think it really is a very important thing to distinguish what we're talking about with different terminology. So, one thing when we talk about the medical side of things, you think about treating a condition or symptomatology, because we know that cannabis can be helpful for symptomatology, but I think patients need to know that we're really not curing anything, at least at this point in time, with cannabis. So we refer to cannabis for a medical symptomatology or condition as really being medical cannabis. And we don't really like the term marijuana because that's really kind of a slang terminology, really referring more to the recreational side. I actually got stopped in a lecture early on when we were studying cannabis, and a patient using it to treat a symptomatology of a condition was very offended and really laid it on the line about using marijuana versus cannabis. And I agree. Now I've grown up and I'm thankful for that comment.
Can you tell us a little bit about the plant? How is that different from hemp? What are the plants themselves that we're talking about?
Yeah, when you talk about that whole cannabis plant, we are talking about a plant that has upward of more than 450 chemical compounds. We know that there are 100 cannabinoids in that plant that have been identified, but some of them are major cannabinoids like THC or tetrahydrocannabinoid or cannabinol. or CBD. Those are the two in the greatest abundance. So cannabidiol is CBD. So THC and CBD are prevalence within the plant. But like I mentioned, there are 100 that we've identified, but we really don't know exactly what they do and what symptomatology they may be good for outside of a few conditions. And there's also terpenes that give the cannabis the nose, but they may also be able to treat some symptomatologies. So, science and clinical trials are really important. When we talk about hemp, we're talking about no more than 0.3% THC. Now, that's in the weight, the volume of the plant. So, those numbers sometimes get a little misconstrued. And hemp has different terminology in different countries. So, the percentage of THC that defines hemp. And then there's hemp seed oil, and that is much different. And patients should never be paying a lot of money for a hemp seed oil because that's really not a CBD product. That is from the seeds of the plant, and that could be involved in food supplementation, that sort of thing. So, hemp seed oil, completely different. Hemp, no more than 0.3% THC and several cannabinoids within the cannabis plant.
That's very helpful. And you mentioned a phrasing that I'm not super familiar with. So I'd love if you could help us understand what that means when you said it gives it the nose or it gives its nose. What does that mean?
It's basically how it smells.
That's very helpful in terms of just setting the groundwork for definitions as we go forward and defining what we're talking about. So then I'd like to kind of move us along to when is medical cannabis appropriate? What types of symptomatology are you thinking about when you're thinking about a discussion around medical cannabis with a patient?
So, really, it comes down to what do we know? What is reported in the literature? And obviously, we look to what do we have that's FDA approved? So, we know that we have one product on the market that is plant derived and purified, which is cannabidiol or CBD. So, we have used their package insert and their clinical trials to really help us in some of our patients that are using a recreational product from a dispensary. So, when we're having that discussion with a patient, they bring it up, we think it might augment their therapy. I go back to what is FDA approved. So we know that with catastrophic epilepsy, cannabidiol can be very useful and helpful. So Lennox-Gastaut syndrome, tuberous sclerosis complex, Dravet syndrome, which are very different types of epilepsy than our garden variety partial onset seizures. Now, THC can actually make seizures worse. So we have that literature. We know we have that body of information. We also know that from other countries, not our own at this point, that almost a 1-to-1 blend of THC and CBD can be very helpful for multiple sclerosis spasticity, also spasticity of other varieties. So, spinal cord injuries, cerebral palsy, wherever you have spasticity. And then we know from our chemically synthetic cannabis products that we have on the market that have been on our US market for a number of years that are very good for nausea and vomiting induced by chemotherapy, also enhancing appetite in patients again with cachexia, either HIV AIDS or cancer treatment. So we really go back and think about what is approved in the literature. And then we look into the literature. Where do we have clinical trials that really support some conditions? We know that cannabis can be helpful for neuropathic pain. Now, other types of pain, we're not 100% sure on yet, but we're looking at it for different types of back pain. We're looking at it for head pain, so migraines, etc. So different types of headaches. There's signals there that we can use these agents, and it's getting the right combination again for the right condition. Even restless leg syndrome, I have a few anecdotal patients. We'll start a clinical trial, hopefully here soon, looking at a blend of cannabinoids to see if that is efficacious in that patient population. So we really go back to what's in the literature to really support our decisions. And we feel very confident of making decisions based on what is in the literature.
In terms of how these compounds work in the brain, so you've sort of laid out a variety of different types of symptoms, different conditions. I imagine that the literature in terms of specific targets within the brain or within the body are still being elucidated. But what do we know about how some of these compounds work in our body and why they may potentially have some benefit?
Well, you're definitely correct there. A lot of those pathways have not really been fleshed out. Some of them have. So in epilepsy, we have a good idea there. And when we talk about THC and CBD, so the two most abundant cannabinoids in the cannabis plant, we have to think about the fact that they're both psychoactive because they both work in the brain. They both produce an effect in the brain. However, THC produces euphoria, so it gets people high, and CBD does not. So I didn't mention that CBD may be a good product for sleep. And we know that's a problem universally in our country and really worldwide, but it helps us sleep. We know that it does produce that effect, and you get that effect from its effect in the brain. So they're both psychoactive, just one is euphoric, one is not. So they both have those common pathways.
What you just said gets me to my next question, which is just sort of in terms of there's so much misinformation or misunderstanding about how to use these products, where to obtain these products. So, what makes sense to me as a physician is that we have certain medications that are FDA approved with indications, doses, etc. That's how we would generally go about prescribing these. So let's start there because there's like a very large spectrum of where you could obtain some of these products and how do we ensure that our patients are sort of matching up their symptoms and obtaining the best quality product to potentially manage their symptoms.
I mean, in Colorado, we're talking about the wild, wild west almost. And we know we have dispensaries on almost every corner. When it first got legalized, patients or people, consumers, were able to go in and get a certificate of analysis. So you could really trace that product right back to the ground. And now some places it's the case, but some places it isn't. So I would definitely say to consumers that if they're purchasing products from a place that might not be very reputable and not be able to produce that information, I think that's problematic. And I think that it really can be very unsafe because we don't know exactly what's in those products. And that's a concern. Once we get somebody regulated, if you're talking about treating epilepsy, you're treating a condition that we know works well with CBD. If we can't get the same product and say, well, keep your dose consistent, do you want to start over again and have to increase or dose escalate to get to the same effect? So if somebody's actively having seizures, I mean, that's not a good idea. Now, there are companies that are very reputable, but you really need to do some digging. And we have a few of those reputable companies that if patients ask us, we can give them a list of those companies. But I would say that you really need to do your homework and ask your healthcare provider to help you try and navigate that landscape because it's difficult. Some practitioners will be able to help you, some won't. Maybe they'll know of someone that can help you. But I think consumers need to know that a lot of those products that you can just purchase, can have heavy metals in it. There could be fungus in the products. They really can be harmful and really not even knowing a consistent dose. I take this amount and I get this effect. That bothers me, and especially on the practitioner side, just not being able to know exactly what to take. It's not like we hand you a medication that's FDA approved and say, well, this time you take this amount and see what effect you get. And then the next time you start over. So I think it's safety. So you really need to be careful about where you're obtaining products and know that probably bud tenders are not the best to help navigate that process in terms of treatment.
Can you talk about some of the potential side effects or risks associated with medical cannabis aside from what we just talked about with regard to these products that may be sourced from places that aren't completely known or may have sort of additional ingredients that could be dangerous to you? What are some other side effects that someone might need to know about?
Well, I think the biggest side effects that we are seeing currently is people not really being educated on the difference between the edibles and inhalation use. So we know with the edibles, the bioavailability is really bad. So the absorption is very erratic. So, really, when you talk about 1 in 4 or 5 people, one time, even though you have the same product, out of 4 or 5 ingestions, you're going to get a very different response. And I gave a lecture in Scotland once, and I was talking about eating cookies. So, that's one of the edibles that we have. People are told to cut it up into like 16 bites or whatnot. Take a bite, wait 20 minutes to see if you have an effect. And I said, maybe in Scotland, people eat cookies that way. But in the United States, that is not how we consume cookies. We eat one cookie, two cookie, three cookie. And then people end up with an acute psychosis or a very profound experience mentally that would be a scary situation. So, paranoia, psychosis, those are things that we see often with that route of administration and not really having great guidance. And then long term effects we can see with habitual use of high THC products. We see that we have a vomiting episode that is a hyperemesis syndrome that is very profound and not pleasant for anyone to experience. But that's with high dose habitual use on a regular basis.
If someone comes into your clinic, where do you send them? What's your step-by-step approach of the counseling and then sort of the giving of the prescription? How does that work?
We're very appreciative to have people that are being open and honest. And that is one thing that I think recreational marijuana has done for us. So they've made it easier for patients to be open and honest about those conversations. And so the first thing that we do is we know that there are a lot of drug interactions, and we talk about that. We look at their medication profile. What are they taking over the counter? What herbal supplements? What else do they do? And do a very thorough drug interaction screen with those particular patients. We then go to the places that we know are reputable or go to a prescription FDA approved medication. And that's the safest overall. I wish all of these products, I mean, I wish we had a representative cannabinoid, from each sub cannabinoid in the plant. I wish we had an FDA approved molecule because then we would really be sure of the safety, knowing exactly what's in it type product. So I realize it's very hard when you're in a state that you don't have those options, but the best thing to do is go back to what we have that's FDA labeled if that's appropriate.
And then how do you talk about recreational use if somebody is sort of talking about the medical use of cannabis and you're concerned that there may be also recreational use? How do you discuss that?
Well, again, we applaud their honesty with that. And we take the approach of being able to go back and look at what we know about the cytochrome P450 isoenzyme substrates or the potential for drug interactions that we have. We're talking about CBDs. So, what we know from those clinical trials, and we apply that, although it's not 100%, but what people are using recreationally. So we take a lot of that knowledge that has been done with those clinical trials and pull that over as best possible to what is being purchased recreationally. With the products nowadays are very potent. We didn't even talk about that, but it's not what your parents were consuming in the 60s and 70s. It's a completely different animal. I mean, you can get almost 90% THC type products, which is scary, especially when that can lay in the hands of adolescents.
So, what else should we be thinking about? What other misconceptions do you commonly hear that you'd like to dispel, given that there are appropriate situations in which this is something that you would want to consider? What are some other considerations that we haven't yet discussed that we should be sure to talk about?
I think mostly it's just, consumers and patients just being honest and frank, and us as practitioners trying to give them good guidance. Obviously, what's in the literature, good, reliable resources, not Dr. Google, because anything could be out there on the internet, and that can be scary and very dangerous for patients. So I think just having open, frank discussions and trying to get more people educated on the difference between these products, and including our practitioners. So they need to say when they don't know and don't understand, and patients need to be directed to the appropriate education. And there are online educational programs directed at different populations. So the lay population, the medical community, etc. Even vets, the pet community as well.
That's great. In terms of giving folks that are listening one bite sized action item if they're thinking about or considering medical cannabis or having that conversation with their healthcare professional, what advice do you have for them to go about having that conversation?
I would definitely say that I would have a list of all the medications that you're taking so that your practitioner or your pharmacist can look up interactions and be clear or have a conversation as to which direction to go. So, which cannabinoid are you looking at? Is it that Delta 9 tetrahydrocannabinol, THC, or is it a cannabidiol, CBD? So, tetrahydrocannabinoid or a CBD product, cannabidiol, it's important to really direct those questions like, what should I be looking at? Or this is what I was thinking. Do you agree with that? That's what I would say. Just open, frank conversations.
Thank you so much for being with us today. You've certainly helped me understand and clarified more about these terms and just how and when to be thinking about medical cannabis.
Thank you so much for inviting me. It was a pleasure.
We've talked with Dr. Jackie Bainbridge about medical cannabis. We've talked about considerations for when you might think about it, how you might talk to your healthcare professional about the fact that you're interested in it, and the really, really important point about ensuring that you think about everything else that you might be taking as a potential interaction with medical cannabis. To find out more information about Dr. Jackie Bainbridge, visit the Skaggs School of Pharmacy and Pharmaceutical Sciences website, which we'll have linked in our show notes. Thank you so much for listening. Please take a moment to follow, rate, and review this podcast on your favorite listening platform. If you'd like to send me an email about topics you're interested in or questions for future guests, please send me a note at webmdpodcast@webmd.net. This is Dr. Neha Pathak for the WebMD Health Discovered podcast.